All right, so once again, welcome to our Intergy imaging training. As I mentioned, we will be talking about setting up the image categories as far as imaging and scanning goes, and we will also take a look at using the module itself. So I'll walk you through our training database on each of these areas. So the first thing I want to show you is starting very high level in the sense of setup. First thing we want to look at is setting up the users. So what we're looking at right now is practice administration. And not everyone will have the rights to practice administration. You have to have the security access to it. So this is somebody of more of setup rights. A practice administrator would probably be someone from your IT, from your MIS team, a manager, or someone that has the rights to set up. So under practice administration is where you will find your user and security. So what I'm looking at right now, this is my PAMIS screen. This is my Intergy Practice Management screen. And when you go to your Setup drop-down menu, all the way at the bottom is your administration. And right across, as you can see, there's Practice Administration. If you don't have the rights to that, then you won't go any further than that. So once you actually log into Practice Administration, you have your little lock and key icon, which is where all the users or Intergy users are set up. So what I want to show you first is a couple of things here as far as user and security goes. So the first thing is the user having the rights to imaging in general. So if this user has the rights to set up files in imaging, or if this user has the rights to actually scan in Intergy, then we need to make sure that that role is set up properly for scanning. So as you can see, what I'm looking at here for those that have the rights to user and security, just to refresh your memory a little bit about this view here. In user and security, this tab that I'm looking at is a role definition. When you are setting up users in Intergy, our recommendation is that you don't necessarily assign their rights at the individual user level. Our recommendation is that you grant access or you set up access based on the role level. That allows you to better maintain your security, that allows you to know who has the rights to what. So for example, so for somebody that's a poster, that would be a role, and I would access security, or I would grant security access based on that role rather than the individual user. So in terms of knowing who has the rights to what and having a control of that, and maintenance, just maintenance in general, it makes life a little easier. So here in the role definition tab, there is a features option here on the left. So I'm going to select features. Dependent of the role that you're interested in looking at, obviously. To the far right, there's different ways to display these features. Our recommendation here, at least to make the process a little easier, is to bubble in subsystem. So what the system is going to do with subsystem is it's going to group together your features, your security features based on like items. So the moment you bubble in by subsystem, it now groups it together, and now you have a whole section, a whole subsystem for imaging. So if this user needs to have the rights to scanning or the rights to set up, then we need to make sure that the imaging is selected. And there's two sections here. There's a section for setup, and then there's a section for scanning. So these first three radio buttons here, or these three selections features here, would be more of the setup side of it. So once, if you're not familiar with setup of the imaging category folders, it'll definitely make a little bit more sense once we get to that part of the training. But essentially these document info type, document source maintenance, source type maintenance, these are actually setup folders. So this is a user that needs the rights to set up these image categories, and you need to make sure they have the rights to these these selections here, these features. And then obviously within each one of them, what do they have the rights to do? Can they add? Can they edit? Can they delete? The last one here is imaging. So this is the actual scanning part. So this user, if this is an end user like a front desk staff, for example, if they need to be able to scan, then obviously we want to make sure that they have the rights to the imaging checkbox. Okay, or at least the folder that, or at least the role that they're assigned to. So again, recap of what I just did. I was in the lock and key icon. We are granting imaging access at the role level, not necessarily at the end user level. We want to have it defined at the role level. I selected by subsystem just to group this together a little easier, and it's easier on the eyes. You're going to look for the features for imaging, the subsystem for imaging. And if you select the first box, that indicates that they have the rights to everything that's imaging related, or you can actually break it down to what they only need. Okay. As far as deleting goes, we usually, in security, we usually try to stay away from an end user having deleting rights. That's usually the overall golden rule for security. But when it comes to deleting a document, we might need to be a little bit more lenient with that. As a reminder, the user might accidentally scan into the wrong patient, and we want to give them that capability of deleting in that sense. So you can definitely look into and analyze what your internal workflow is, and define if the user should have the rights to do so or not. But keep in mind of that scenario, that you have an end user that has accidentally deleted the wrong document in the wrong patient or vice versa, and they need the capability of deleting. So that's where your deleting pages or deleting image comes in. So keep that in mind. The next thing that I want to mention to you here, so we talked about the features, meaning the rights to actually being able to scan in Intergy. The next thing I want to show you is the access levels for the images themselves. Okay, what we're seeing here on the left, so I'm still under role definitions, and I went from features to imaging. What we're looking at here are the document info types. The document info types are kind of like the filing cabinet. Let me pull up real quick an image that I have here for you of when you're scanning. When you're scanning a document, you need to select what category is that image going to be stored in. So the category, the document info type itself is the cabinet, the filing cabinet. Okay. So most of our organizations, most of our centers have a filing cabinet called patient imaging. That's usually the standard verbiage. Okay, it would say PI for patient imaging, and everything you scan goes into that one filing cabinet. So you have that filing cabinet and multiple folders in it, and we'll talk about the folders in just a second. But patient imaging is the filing cabinet itself. So every time we choose to file something, for the most part, it goes into the patient imaging document info type, which again is essentially the filing cabinet. Some centers have gone as far as creating additional filing cabinets, if you will. As you can see, my training database has examples of different ways of how we can utilize these document info types. We will be going into that folder in just a second, or how do we actually add to that. An example of what some of our centers have done is like a behavioral health filing cabinet. So I have my main one, which is patient imaging, and that's used for my medical documents, let's say. And then I can create a whole different filing cabinet just for behavioral health. And one of the reasons and that's an easy step. And one of the reasons that feasible step has been done is because I can restrict certain users from not going into that filing cabinet. So think about it that way in terms of confidentiality in certain types of documents. So that's exactly what we're doing here. We are allowing, or we are restricting users from certain filing cabinets. So if this user is not only able to scan, which we just went over that, we need to make sure the user has the rights to scanning into that filing cabinet. Okay, so this patient imaging, which again, the majority of the time it's the default name that you're going to have in your system. That is the name, and you want to make sure that that is checked. That means that this user has the rights to scanning, or this role has the rights to scanning into that filing cabinet. If your organization has gone as far as creating a whole separate filing cabinet, kind of like how I just talked about for behavioral health, let's say as an example, then obviously that role or that user will not have that box checked, and that will prevent them from going into those filing cabinets. And the actual term in Intergy is called document info type. Okay. All right. So again, we talked about allowing users to have the rights to scan or set up the files, and that's a feature. That's called features. And then we went over users having the rights to the actual filing cabinet itself, and that is imaging. So whatever filing cabinet is checked, whatever document info type is checked is what they have the rights to. Whatever is not checked means they don't have the rights to. The other thing that we are able to do from here is the access level. So there's low, medium, and high access. The system's default is medium access. After speaking further with Greenway, the vendor for Intergy, they have mentioned that they do not actually restrict or have actually defined what the access levels are. That ultimately it is the center's choice. The centers will define what the low, medium, or high access is. So, for example, if you have a front desk role, somebody that works at the front desk, and they should not have the rights to certain documents within that filing cabinet, I can make it a low access, for example. But again, you will be the one essentially to define what these access levels are. Okay. This is where I actually define the access level. Once we get into scanning of the document, then there I'm going to show you how to actually tell the system if that document itself is a low, medium, or high. So if I scan a document and I make it a high level access, then somebody that has the rights to low won't be able to see it. So I'll show you the association of what we're looking at here to when actually scanning the document itself. Okay. So as far as user and security goes, again, we talked about access to the feature itself, and we talked about access to the document info type, which is essentially the filing cabinet that we are scanning documents to. Okay. So now I'm going to go ahead and jump to the practice management side. We're actually going to take a look at the setup files that are pertaining to the scanning module, to the document imaging module itself. But before I actually get there, I want to point out to you exactly what we're going to be setting up. Okay, so the easiest way for me to show you that will be to pulling up patient information. So what I did was I went to the Blue Man, and I pulled up, and again, I'm working off of my training database. So these are essentially our fake patients. I pulled up a patient here, and I went to imaging here on the left, which all these steps I'll definitely recap when we get to the using aspect of our training. So I went here to imaging on the left, and I'm going to just follow the motion here of scanning a document. So the intent of me bringing you here was to show you what we're actually going to be setting up. So I'm going to click on my category drop-down. So here I'm telling the system what filing cabinet do I want to scan this document into? So again, if we're associating what we're looking at now to what we just saw in the setup, this is it. So these are the filing cabinets, which again is called patient imaging or whatever else this user has the rights to. So as the way I'm logged in, I only have the rights to a couple of different filing cabinets versus a few others that were there, if you recall that from our previous screen. Okay? So this user only has the rights to patient imaging and one other filing cabinet. If you wanted to create additional filing cabinets, we'll be taking a look at that in just a minute. So let's say the document I'm about to scan in goes into the patient imaging filing cabinet. Once I select that, I now have to select my category, which are essentially the folders inside of the filing cabinet. And this is what I'm going to walk you through now. What I'm going to walk you through now in terms of setup is how to create these folders that fall into that filing cabinet. Okay, so again, these are called categories. So I'm going to teach you how to create these categories, which are the folders. Some other items that I'm going to show you how to maintain and create are the attributes. So once I pick the filing cabinet and the folder that this document is going to be filed in, I then need to enter the attributes of this document. Attributes meaning the description of this document, or maybe a date, like the date of service, of the date of the exam or the date of the procedure. I can create different attributes, different information that pertains to this document. Description would be the most common one. So I'm going to show you how to create attributes associated to that folder. A lot of our centers have descriptions where you just type in, where it's free text. And that leaves room for misspelled words. That leaves rooms for no consistency there, some inconsistency of one user typing it one way and the other one abbreviates, for example. So what I'm going to teach you is how to create a drop-down list in your description. It definitely makes it cleaner. If you're pulling reports based on this information, it makes it more accurate, obviously. So I'm going to teach you how to create a drop-down list in your descriptions, and those are called lookup codes. Okay, so there's a couple of things we're going to talk about here as we go through setup, continue the setup part of training. We're going to talk about creating category folders, and we're going to create attributes. Okay, and we're going to create a drop-down list for descriptions. Okay, as a reminder, we talked about setup. We talked about security access for this. As you can see, there's a new button here. We want to make sure that the end user, if they're not a user to have setup rights, we want to make sure that they don't have access to that new button, or else your clearly defined description list can now grow if you have many users going in there adding information. So as far as security access goes, make sure that the users don't have the rights to adding these. All right, so now that I gave you a visual of what we're actually going to set up, let's take a look at it. I did go ahead. I unfortunately cannot have both windows open at the same time during training, meaning what I just showed you versus the setup files. So I kind of pulled it up here in a Word document just in case I have to come back to it and remind you what we're actually setting up here as we go through it. All right, so let's jump into our setup files. So the first thing we're going to take a look at, and going back into setup, again, we talked about security, so you're only going to have the rights to do this if you have been given the access to. The first thing we're going to take a look at here under setup is imaging, is called the imaging folder. Underneath the imaging folder, we're going to go ahead and go into document info type. The first thing we're looking at here, document info type. What we're looking at here is the filing cabinet. So remember earlier I said that as a default, most of our centers have one filing cabinet, and it's called patient imaging, and everything goes in there. But we have other centers that have expanded on that. They've decided to maybe create a behavioral health filing cabinet, and this is where you do that. So if you only have one filing cabinet, then here under document info type, it might just say patient imaging. That's all it might say. Okay. If you wanted to create that second filing cabinet, then you just simply click new here and create that new filing cabinet if you wanted to take that route. But as you can see, I'm going to work off of what I already have there. So again, quick recap. Right now I am under Setup, Imaging, Document Info Type. Underneath the Details tab, or in the Details radio button I should say, is the default Patient Imaging Info Type. So this is the standard filing cabinet that most centers already have. Again, if you wanted to create a new filing cabinet, then you would have to click New here. So this is the one that our centers mostly have, patient imaging. And underneath that, here are all my folders. Here are all my categories. These are all the folders that we actually scan documents into. This new button here is to create the filing cabinet. So for you to actually create the filing, the folders that fall into that category, I actually have to bubble in the categories radio button. So the first thing you're going to do is click on the Details radio button and make sure you select the filing cabinet that you're looking to work with, that you're looking to set up. In this case, the patient imaging, which is the system's default. So now that I have patient imaging selected here, I am now going to bubble in categories. As you can see, it still says patient imaging, and then underneath it are all the folders that fall into that cabinet, that filing cabinet. Here is where I can edit a folder. Here's where I can add a new folder, and these are called categories. Okay? These are called categories. Remember, this is what we're talking about here. When you are scanning in an image, you have to choose your filing cabinet, which is called patient imaging, and you have to choose your folder, which is the category itself. And that's what we're looking at here in our setup. So as I mentioned, you can add a new folder, you can edit an existing folder, and you can use your up and down arrows to rearrange it. Sometimes when you're scanning in, these folders are not necessarily in the right order. You can definitely scan it and rearrange them, maybe to keep your front desk folders together. Maybe keeping your clinical folders also together. So anything that's front desk related, you can move them up and rearrange them so they can be all together, and you don't have your end user necessarily going all around different categories finding what they need. So to move them around, you just highlight what you need and move it up with the arrow. And that's how you can rearrange these category folders, and it makes the end user's process a little easier there. So I have that. Let's say I want to move up Advanced Directive. I can move that one up to the top as well, maybe right underneath Patient Info, etc. If I want alphabetical order instead, then I have my Alpha Sort button, and it goes in that order instead. For the most part, if I'm not mistaken, the default is usually the order, the way of entry, the way you actually create them in Intergy. So you would have to rearrange them by clicking on the arrows or alphabetical order. So let's say, as I mentioned, these are my categories. And down here are my attributes that are associated to that folder, to that category. And like I mentioned earlier, description, date of procedure, date of service is usually some common attributes that when you're scanning, you should have when you're scanning. So if I pull up my image here real quick, these are your attributes down here. Description, for example. Okay? So let's go back here. So for training purposes, I'm going to go ahead and add a new one. Okay? So again, my category, my document info type is patient imaging. For training purposes, I'm going to go ahead and create new. And let's say this one's for discharge records. I'll just call it DC, and then I will go ahead and call it discharge records. Okay. So you're giving it a code. There is a limitation there, about 5 or 6 characters, and then you will enter your description. I'm going to go ahead and save. And the system just allows you to stay on the new category window in the event that you are just adding new ones back to back. In this case, I'm just going to go ahead and close, and here is my discharge records. I can now move it up if I wanted to and bring it to the top of the list if that's what I want it to do. And I'll go ahead and do that just for training purposes. Okay. So again, I clicked new, and I created a new folder that I'm going to scan images into called Discharge Records. Now, I need attributes associated. I can't really go this far. If somebody tries to scan into that folder, now they're not going to have the appropriate information before they save that scan. I need a description field here as a minimum. So now I'm going to create my attributes that are associated to that folder. To do that, I'm going to click on this new button here. So on the bottom right, by attributes, in the attributes section, I'm going to click new. So I'm going to create a label here. Okay, the label is the name of that field. So if I pull up my image, you see how it says description here in bold? That's a label. Encounter, that's a label. And the value is what's going to go into that field, that label. So I can create a label called description. I'm going to call it description. Now, what kind of data goes into that field? That's what your data type is. Do I want the end user to type the description of that document, which, as I mentioned, is usually not our recommendation there, especially if you're trying to keep it uniform or pull data from it. So your different data types here, these are the different types of data. What are we actually entering in that description field? Are we typing in characters? That would essentially be free text. Does the user need to pick a date? Does the user need to type in a number? Our recommendation, based on what I mentioned earlier, which is a drop-down list. Okay, so if we leave it as characters, the user will have only the rights to type in the description of that document. And we already talked about the inconsistencies that we will face with that. So our recommendation, and as you can see, you have a length character there as well. I'm going to go ahead and pick user-defined lookup here. Now, it's asking me now, okay, you want me to look at a certain list in this field. What is the name of that list? And that's really the second part of this training, of this setup here. I now have to tell the system where is that list located, and that's a lookup code. Okay? So I'm going to go ahead and keep this as character for now. And we will come back to it so I can show you how to actually change my attribute into a lookup code. So again, my label is called description. Our recommendation is to make it a user-defined lookup data type. And what you want to do is check this box that says display as description. Display as description means that my description label would be the first one at the top. And of course, you want to make it required. That way the user will not accidentally save this document without the description of the document. So again, let me go ahead and save here real quick, and then I can recap the steps that we've done. So I created a new category folder by clicking the New button here on the left, and I called it Discharge Records. I want the user to be able to enter a description of these documents. Therefore, I created an attribute underneath that Discharge Records folder. So on the bottom right, I clicked New, and I created a new label called Description. I don't want the user to free text. I don't want the user to have to type in what that document is to avoid inconsistency. So what I'm going to do is make it a user-defined lookup. I want this description field to be a user-defined lookup. In addition, I want to check these two boxes. I want to display this new label as a description, and I want to make it required. Display as description will do just this. It puts it at the top of my list. As you can see, description is at the top, or else it would have fallen to the bottom. It's the first selection at the top, and it's marked yes for required. If I wanted to add another attribute, so when I scan in my discharge records, let's say I want a date. Maybe I want the date of admission, or I want the date of discharge. If you want the user to enter not just a description, but also a date, I can very well come in here, click New again, and create another label. It's a data, I'll just put data service for training. I want the user to pick a date, and I want to make it required. I'm not going to select my display check this box to display as description because I do not want it to be the first one on the list. So now my user will be able to enter a description and pick a data service. If I want to add a third one, I can click New again. If I need to edit what I just did, I can click Edit, or I can delete if I made a mistake here. All right, so this is part one here, creating the category, which is the folder, and creating my attributes. But because I want my attributes to be a lookup code, I now have to go somewhere else in Intergy to create that list. Okay? So let me pull up the screen here again. So if I'm following the motions of actually scanning, right? If I'm following, here's my new folder called Discharge Records. Here are my two new fields, description and data service. I don't want the user to type in my description. I want a drop-down list. So we'll have, this is what the example will look like. I get a drop-down list with a list of codes to choose from. So that's what I'm going to show you. That's what I'm going to show you now. I'm going to show you how to create that drop-down list, which is called a lookup code. All right, so let's do that by going back into our setup files. So I'm going to come back to this. I'm going to come back to this because I have to create my lookup folder first before I continue here. So I'm going to come back to this. So now I'm going to go back to my setup folder. And if you're looking to revamp your image categories or to create these drop-down lists, because you might not have them currently, you might want to create all your lookup folders first and then come back to the image categories. That way you're not necessarily back and forth. So maybe create all your lookup folders first and then come back to the category. So back under setup, we're going to go into lookup, user defined. Lookup, user defined. And again, you have to have the rights to have access to the user defined setup files. Okay, so the first thing we're going to do is create the lookup type first. Okay, and then after we do the lookup type first, we will then create the list. So my lookup type is the name of that list, if you will. So I created a new folder, a new category folder called Discharge Records. So I can easily call my list Discharge Records. I can call it the same thing, and that's what I'm going to do now. So once you go into user-defined lookup maintenance, which is where we are now, the first thing you're going to do is create the name of that list. And you do that here in the Details tab. In the Details tab, you're going to click New. You're going to give it a type. I'll just call it Discharge Records. I can call it the same here, or however you wish. My label can just be description. And I can have a number of characters here if I wanted to. I went ahead and saved that, and now I have my list name. So I am creating a list for my discharge records. I called it Discharge Records. My label is basically a description, and I have a max character of 15. So now I'm going to actually create the list options. So when somebody scans in, and again for training purposes, let's say I'm creating this folder here, and I want the users to be able to pick ER discharge records. I want them to pick admission records, or maybe I want them to be able to pick urgent care discharge records. Instead of them typing urgent care, ER, admission, I want them to pick from a list. So now that I've created the name of that list, I'm going to bubble in lookup codes, and now I'm going to create that list itself. Okay, so I went from creating the name of the list itself here in the details to then creating the list itself, the options in the list. And those are the actual lookup codes. So I bubbled in lookup, and I'm going to click New. So here is where I'm actually going to create that drop-down list that we were talking about here in our scanning. Okay. So I'm going to go ahead and click New. And let's say the first one is and I can, make it less characters if I wanted to also. So that's my first one. I want the user to be able to pick from the drop-down list, and emergency room would be one of them. Let's say the next one is hospital admission. I create my code, which is just an internal code, and then the description. And the user will really see both when they're picking it. They'll mostly go off of the description. So you want to make sure your descriptions are easily identified. And then lastly, let's say urgent care. Just to give you a list here for training purposes. And I'm going to go ahead and save. I don't have any other ones to add, so I'm going to go ahead and close. So now if you're putting these puzzle pieces together, we created the folder called Discharge Records, where we want staff to scan documents into. But I don't want them to I don't want them to manually type in the description. Therefore, I'm going to give them a list to choose from, and that's what we just did. Of course, as we go further into our training, I will definitely recap all these steps for you. So now I have created my list, right? So now I need to go back into my categories. I need to go back into that newly created category folder that I created called Discharge. Remember, that's where your attributes are. So now I want to tell the system here in attributes to go look at that lookup code list. Okay? So I'm going to go ahead and edit under Discharge Records. I'm going to go ahead and edit my new label that I just created called Description. I'm going to edit, and I'm going to change it from character to user-defined. So by picking user-defined lookup, I'm pointing it now to go look at that list that I just created for Discharge Records. So I'm going to click on the drop-down, and I'm going to look for my Discharge Records, the new list that I just created. So you can see how I mentioned earlier where I said maybe as you're revamping or looking to revamp or redo or clean up your image categories, think a little bit or analyze first what your lookup codes would be and maybe create all the lookups first and then come back to your categories and edit them. That way you won't necessarily be back and forth between these two setup files. Because as you can see, I cannot assign a lookup code unless I've already created it. Okay? So I'm going to go ahead and save it. And now I close that loop. I'm done. I'm done with the setup of this new folder. So now the users can access that folder if they have the rights to. They can scan into it, and they can choose from my new list. Okay? So let's take a look at it, and of course I will happily recap these steps for you. So now if I'm back on patient information, if I were to want to scan a new document here, I'm going to click New. I'm going to go back to Category. My filing cabinet is called Patient Imaging, and I want to scan into my Discharge Records folder. I don't want to have to type in my description, and now I don't have to because I have a drop-down list. So I'm going to click on my drop-down list and pick from the list I just created. So let's say I'm about to scan in emergency room discharge papers or documents. I've given the user also the right to enter a date of service. So maybe here I'll put the actual date of discharge. That way when we're looking at the documents, we have a little bit more information. We don't necessarily have to go through it to see what the date was. We can actually go through it and take a look at the date. I made this a required field, therefore the user will not be able to properly save without choosing that data service. Okay? So what we did in training was create the category itself, which is the folder. We created the attributes that fall under that folder, which we called it a description, and we called it data service. And we made the description a drop-down list, and we made data service a date option. They're both required, and now the user, and there's consistency. I can now actually, everyone will be selecting the same verbiage as we're scanning in documents. You know, you might have somebody, if this was just a type in, you might have somebody that writes ER only. Or you might have somebody that writes the whole word, emergency, or the whole word discharge, or like I did here, D/C. You're not going to have consistency if you're just allowing the users to type them in. Okay, so quick recap on what we did. Actually, before I do that, I do want to remind you, our HCN quality team in previous times had recommended for you to create specific folders for scanning in certain clinical data. A few years back, in terms of running reports and meeting measures, quality measures for mammogram, colonoscopy, podiatry reports, Intergy in the past allowed for these measures to be met based on the scanned document. So we did have specific folders that these documents needed to be scanned into in order to meet these measures, these quality measures. Intergy itself changed a little bit, so we're not necessarily not able to get credit for a mammogram by simply scanning it into the mammogram folder. Now we actually have to properly document in the HCN quality measures form in the EHR. However, we still have that as a best practice where you should be scanning in documents into these predefined folders. When this was implemented a few years back, HCN actually went into each one of your databases and set these folders up for you. So for the most part, they probably already are set up in your Intergy as categories. But this will be part of the supporting documents that I'm going to send you after training. These are some of the category folders that we do recommend. So remember where I created the category called Discharge Records? Well, here's where we're calling mammogram, colonoscopy, etc. Okay, so this is a recommendation, even though, again, we do not meet the measures, these quality measures, by simply scanning in the results into these folders. Unfortunately, Intergy doesn't have that feasibility any longer. However, it is still our recommendation, still our best practice to continue to use these folders. So a quick recap on the folders that I touched base on in order to set it up. Okay? So I'm going to go into Setup, Imaging, Document Info Type. In Document Info Type, you set up two things. You can set up the filing cabinet, and you can set up the folders that are inside that filing cabinet. So again, Imaging, Document Info Type. The Details radio button is the filing cabinet itself. It's the document info type. It's the filing cabinet, which for the most part, many of you on the line have it called patient imaging. So that's the filing cabinet. So if you already have that set up, most likely you're not going to touch the details radio button, or add new ones, I should say. If you want to add folders, new folders to that patient imaging info type, then you're going to have to select it as I just did here, and then jump to category. So the first thing you're going to do is highlight details, and select the filing cabinet that you want to add to. Once you do that, jump to Category, and here's where you're going to click New to add or create the new folders, as I did, and I called it Discharge Records. So once on the left you click New and you save that, then you're going to come down here to the bottom and add your attributes. The attributes that you're going to add as a minimum is called description. We want the user to put the description of the document. And we want that description to be a user-defined lookup type. So you're going to create a new attribute, and you're going to call it description. You're going to make it a user-defined lookup type, and underneath the lookup type field itself is where you're going to tell the system to go look at that list, and we'll talk about that in just a second. We'll recap that in just a second. My recommendations is to make your description display as description and to make it required. So I am calling my label description, but by making it required and displaying it as description means the user will be forced to select the description, and my description will be the first thing they see. If you click New again, you're allowing the user to enter more data on this scanned document. For example, data service, as I did here. And I can very well make that one required also. Okay, so we went to categories, we added new, and then we did new attributes. But because we want the system to look at a lookup code list, I then have to create the list itself. And we do that by going to Setup, Lookup, User Defined. Underneath User Defined, the first thing I'm going to do in the Details radio button is create the name of the list. So if I want to create a list for Discharge Records, then my lookup can actually be called Discharge Records, as we did in training. Okay, so that's the first thing you're going to do in Details here, is create new and create the name of the list. Once you create the name of the list, then I'm going to jump over here to Lookup Codes to actually create the list itself. And all you do here is click New and start adding to that list. So I used Discharge Records in our example for training today, but to use examples of what you actually have in your systems today, for example, you might have correspondence as an example. Or you might have consultation reports as an example. So your lookup type will be called correspondence or consultation, I should say. And then you're going to create a list. I can create a list, cardiology, podiatry, all the different type of consultation reports that might come back to you in your organization. Okay, so you're going to click New and create the name of each one of those options that you want them to pick from. As you can see, I also have arrows here, so I can rearrange the order, or I can make it alphabetical order. The nice thing about the arrows is that some of these folders are going to be used more than others. So if I want to make hospital admission the first one on the list, imagine if right now it's a list of 3, but you might have like a list of 20 to choose from. I can use my arrows to move up to the top the most common lookup types or the most common options that the user is going to be picking rather than scrolling every time. So as you're doing this setup, obviously we want to keep the end user in mind as well to make it feasible for them on their end. Okay, so those are the basic steps for creating our category folders and our descriptions, our attributes, which is the drop-down list for descriptions. Okay, as I mentioned, some of my follow-up documentation will be these steps that I just went through. So I'm going to go ahead and pull back up the blue man icon here so I can just follow the motion of scanning again and talk to you about a couple things there. So let's search for, and the step that I'm following here is a very common step for your front desk staff. You know, your front desk staff, when they're scanning in patient registration packets, when they're scanning in any document, financial records, financial documents, usually pulling up the Blue Man is a common step for them as well. So once I pull up my test patient here, the first thing I want to show you here on the left is the imaging option itself. So this is where we actually scan documents. Imaging for me, you may, if you are accustomed to be in this window, you might be thinking, well, my imaging is all the way at the top. Well, that's because I rearranged it, and that's what I want to show you now. Imaging, for the most part, kind of falls down here in the middle. I want to remind you that your users, because this is something that will be done per user, I want to remind you that your users can rearrange my tree option here in patient information. So if I work at the front desk, I can rearrange my options so that the pertinent areas of patient information that I need are all the way at the top. So how do you rearrange this tree option here? Well, you're going to come up here to Options, and you're going to click on Page Order. So as you can see, imaging right now is all the way at the bottom. So if I go to Page Order, I can look for imaging, highlight it, and click on my up arrow and move it to the top. The only one that's stationary that I cannot move is personal. Personal will always be the first one on the list. So as someone that works at the front desk, I definitely want imaging to be further at the top. Not necessarily relevant to this training today, but privacy, sliding fee, scheduling, I can move those up further to the top. And it makes my workflow a little bit more seamless. So again, all I did was highlight and move up with the arrow. And that allows me, once I hit save, that allows me to rearrange my folder, my option, I should say. So now imaging is the second one on the list. As far as scanning goes, we also scan in picture IDs and we scan in insurance cards. Okay, so we don't necessarily have to make copies of insurance cards and scan that. If you make copies, that means you're scanning into imaging. But Intergy has a way where I can actually scan the actual card directly into, which for the most part, the majority of you on our call today is aware of that. But just to remind you of that as well. So here, right now I'm looking at personal summary. All the way on the bottom left, we have photo ID. As you can see, here's my scan option, where I would scan in the patient's picture ID. And scanning in the front of the card would obviously be the only option necessary there. So you place the picture ID in your scanner and you press scan, and that scans in the picture ID. In just a little bit, I'm going to be showing you also the actual window of the actual scanning process in just a second. Same thing for the insurance card, as I mentioned. So again, I don't necessarily have to make a copy of the insurance card. I can scan it directly into Intergy. So what I'm going to do is I'm going to highlight the insurance where that card belongs to and come over here to the right where it says insurance card. I'm going to place the insurance card in my scanner and I'm going to press scan. It is important to scan the front and the back of the insurance card. Okay. Now going back to imaging itself, coming here to the imaging option itself in patient information is mostly if I'm scanning in documents. So as I mentioned, if I work at the front desk, some examples that I'm going to scan, somebody from that department would scan, is the patient's financial documents, anything that they may have brought in for their visit, perhaps their last year's tax return, whatever proof of income they brought in, their registration packets, etc. So I'm going to go into imaging, and as you can see, this patient already has images scanned in, so it clearly tells me the date of that scan, the description, and the category that it's scanned into, which essentially is the folder. I'm going to walk you through the motion, just a quick recap here of actually scanning into Intergy. So I'm going to click New, and this is an area where we were in earlier. And here are our patient imaging filing cabinet and our new folder that we call Discharge Records. I'm going to come down here, select my description, which in this case is emergency room, and I can go ahead and put the discharge date here as a reference. So my date of service is 5/28. So I now specifically know and can see that this documentation was from a date of service of 5/28, which is different than my reference date. My reference date is the date I'm scanning today. Essentially, that's what that means, the date I'm scanning in versus the actual date of service. Some organizations, some centers actually use a reference date to change and actually use that as the date of service instead. And here is my access level. So if you recall earlier on in our training where I said that you can actually grant certain access level to the user. So if somebody scans into patient imaging, which is what I'm doing now, what access level do they have in the documents in that folder? Low, medium, or high? As a reminder, the system's default is medium. After further consultation with Greenway, the vendor, they have stated that from their end, they have not defined what each one of these access levels are. That it's ultimately up to the center's preference. So if this user only has rights to low access documents that are being scanned in, if I set this one up to a high, then that user is not going to have the rights to it. So that's the association there. If in the setup I say the user only have access to low access documents, but I'm setting this one up to high, then the user will not be able to see this document. So that's another level of security, another level of confidentiality, if you will, in terms of what you're scanning in and who has the rights to it. So this is where I actually define my access level if I'm actually maintaining that. Otherwise, for the most part, the centers are leaving it to the default. But if you're actually defining access levels per document, this is where I would define it on the document itself. Okay. So at this point, I would have a button here that says to scan multiple pages. So I'm going to click on that button. I would then actually click on that button to start scanning. I do want to pull up a document here real quick just to show you what that window looks like. So for example, if I am scanning in documents, so for your front desk staff who are usually scanning in an ID card and documents, they kind of have to tell the scanner first what they're scanning. If I'm about to scan a document, then I need to change my settings from a document scanning, from an ID scanning to a document scanning. All that is done up here in my setup. So when you go to Setup Scanner is where you really toggle between ID card and document. Usually the user will see that they have not made that change when their document is now the size of an ID card. That's an indication that they did not go into the setup of that scanner. So before I prepare to scan that document, I want to make sure that I am set up to, my scanner is set up to receive paper at this time, document versus an ID card. So you do that by going to Setup Scanner. And this is a window that's going to pop up for you here that I've pulled up here on the screen. So the first thing you're going to see is this template name. When you go to Setup Scanner, you're going to select the template name. And this is where you toggle between document and ID card. The document is typically, the paper size for document is just a regular letter size document. When you choose ID card, there's different options there. For example, the Medicare, the example of a Medicare card, that would be the standard size. It's like a 3 by 5, I think, is the measurements there. When you click on paper size, when you're scanning in an ID card, there's different options. We worked with some centers where it scans vertical instead of horizontal. So you can actually change that paper size, that scan card size there, if you're scanning vertical instead of horizontal. So there's different sizes. I want to make you aware that there's different paper sizes for not only a document, but most definitely for an ID card that you can toggle with to make that a perfect scan or an almost perfect scan. Okay. The only other thing that I want to show you here is this options button down here. When you click on the options button, when you're looking at your scanner settings, when you click on the options button, there's a DSKU checkbox there. You want to make sure that you have that selected. So you want to make sure that all your users have that DSKU option selected. What that's going to do, it's going to help with the alignment of the scanning. So if you see that a lot of your users are scanning picture IDs and they're a little crooked, you want to make sure that that DSKU option is selected. It helps with aligning the way it scans. And again, the way I got there is I went to Setup, Scanner, okay, and then this window will come up. And on the bottom left, there's an Options button. And in that Options button, there's going to be a checkbox that says DSKU. And you want to make sure you select that for all your users, per user, per workstation. Okay, so at that point you selected the category, you selected your description, you selected your data service, you changed your scanner settings from ID card to document, meaning I'm scanning paper now, and I would select on my button to scan multiple pages. What the system is going to do at that time is going to start scanning your page or multiple pages if you had more than one, and then you would have to save that document. It won't let you move any further unless you save. After saving, something else happens after saving. Let me pull up a scanned document here. After saving, you're going to see a couple of icons pop up after saving. And I want to make you aware of these as the second one here, which is the little camera. This one is newer. This one is newer here, or the little case, I should say, the briefcase. This icon is fairly newer into Intergy. This one came out a couple of versions ago. For the most part, we are seeing our centers utilizing it. We also have come across a couple of centers that are not using the feature entirely. And what it does is what it clearly says there now that I'm hovering over it, attach image to order. So as we know, before this feature came out, ultimately we left it to the provider's responsibility to close the loop of an open order. So just to give you a high level of what I'm referring to in the event that for the folks that are on the line may not be too familiar with the EHR side. When the provider requests for the patient to get a test done or a procedure done, they're going to create an order in Intergy. Okay, and eventually that order is going to get resulted. So if the patient goes to get their blood work done, if the patient goes to get that x-ray done, then at this point we are expecting for the results to come back. When the results come back and get scanned in to the system, the provider will then receive a task message with that result, with that image, where the provider will then review and electronically sign off on that result. A couple of versions ago, it was ultimately the provider's responsibility to associate the order that result originated from. So if the doctor is looking at an x-ray of the chest and the patient has an open order for a chest x-ray, then I need to link them both. The provider would have had to link the order to the result. But now we have this new feature. We have this new feature here where the person who is scanning can already attach the order to the result. That way when the doctor gets it, all they have to worry about is just electronically signing off on that result, and the order automatically closes. So if your organization has a high volume of open orders from older dates, chances are a lot of it is because we're missing that step at the provider level. But now we can actually attach the order while we're scanning, so we already take care of that step. The moment the provider reviews that result and electronically signs off on it, we're kind of killing two birds automatically with that one stone. The provider is signing off on their image, on their result, and the order will be closed automatically because the order is already attached to the image. So perhaps this is your support, perhaps this is your clinical support staff that scans results. Or maybe you have an HIM, a medical records department, that does the scanning. Regardless, the motion of the scanning is the same that we talked about today, as I just showed you here. The difference would be after we save, if we're going to click on this button or not. Okay? So let me go ahead and just pull up a record here. So if I just scanned an image, and that image is associated to an order, I'm going to go ahead and click on this Attach Image to Order icon, and I'm going to get a list of open orders that this patient has. So if what I just scanned is a cardiology consultation report, I'm going to select that order, meaning that that order is linked to this result. And I'm going to click Attach. So now I'll be able to task my providers that image, that result with the order attached to it. Okay, so I want to remind you of the Attach Image to Order step there, that the provider, where the provider will receive that task with the attached image. And the order will already be associated to it. If I would have used instead my new task button, that means that I'm tasking the provider this result so they can review on it, but my order isn't attached to it. If I use my clipboard instead. The clipboard is what used to be there always before my other icon feature came about, where the providers will get the task, they will review the result, and then ultimately it would be their responsibility to link the order to the image. But now we have the Attach Image to Order step instead. So the step I just showed you was scanning directly into the patient's account via patient information. Scanning itself is a module on its own. So perhaps if you have a medical records department, maybe they're not going directly patient by patient through the Blue Man. There is, as I said, it's a module on its own. So if I go to clinical imaging, I can go into Digital Office Manager, which is actually the name of the module. Digital Office Manager, candidly known as DOM, is the actual name of the module in the scanning module in Intergy. So here under Clinical Imaging, Digital Office Manager is where I can actually just, if I'm only just scanning all day, I can come in here and just scan patient by patient, one after the other, without actually going into the patient's account. So if I was scanning here, I would have to go to File, New Document, and the steps will be very similar. So again, File, New, and then I would just pick my category, which is my filing cabinet, my folder, enter my description, kind of like how we just went through. I will place my documents in the scanner, and I will scan multiple pages. Once I'm done, I save it. And I can continue to add, I have a little icon here for adding new document. I can just continue to add new documents, whether it's this patient or a different patient. When you come into this window for the first time, what you will automatically see is a document search option. So if I go to document search, that means I am searching for documents. So if I want to see documents that have been scanned into discharge records, if I want to see documents that have been scanned into patient info, either for a certain attribute or a certain patient, let's say Brian Abner. Let me pick someone else. So once I click search, whether I'm looking at a specific patient or I'm looking at a specific folder type, it will show me any document for that patient or in Intergy that's associated to that folder and any date or any attribute that I may have selected. So let me go back to my patient imaging. So I selected my consults folder. I don't have a specific name. I don't have any specific date or attributes, so I just click search, and it brought up any document it found in Intergy, scan into those folders. So obviously with a large patient database, I'm in my training database, I only have 3, but in your organization, obviously you're gonna get a lot more response here. I can actually click on my document, I can double click on it, and the image itself comes up. Okay, so again, that was under Clinical Imaging Digital Office Manager. I can search for documents there, or I can actually add new documents from here without actually working in patient information itself. Again, this is primarily used mostly by your medical records department or someone that just typically scans throughout the day. When you're looking at an already scanned document, I want to remind you that you don't necessarily have to double click on it to view the document itself. I can just click view here. I can highlight and click view. There is a view button right here. And then the document comes up. As we were going through scanning, I mostly talked about scanning multiple pages. As we were going through scanning, I mostly referenced the button for scanning multiple pages. But I want to remind you that there is an option called Import from File. Import from file will allow me to actually scan in a document that's saved perhaps in your P drive or in your U drive, and it allows me to bring in a document that way instead. So instead of scanning, I can actually bring into Intergy something that's saved in your computer, whether it's the P drive or the U drive.